Welcome to everyone. This is a really special meeting this evening with colleagues from right across Europe. My name is Mike Holmes. I'm a GP in the UK and the Vice Chair of the Royal College of General Practitioners. Tonight I'm joined by colleagues from Spain, Slovenia and Portugal, all members of WONCA and UEMO. We're each going to talk about the situation regarding COVID-19 in our respective countries. But first of all, perhaps I could ask you just to introduce yourselves. Vesna.
Hello to everybody. My name is Vesna Pekarević-Đakulin. I come from Slovenia. I'm since this year Vice President of WEMO. I'm a President of Primary Healthcare Committee at Medical Chamber, and also I collaborate a lot with our students of family medicine in Slovenia.
Thanks, Vesna. Joseph?
Hello, I'm Joseph Vilaseca. I'm a GP working in Barcelona City, and I am also the Honorary Treasurer of WONCA Europe.
Thanks, Joseph. And Catarina?
Hello, I'm Catarina Matias. I'm a GP in Coimbra, in Portugal. I am one of the Portuguese delegates in UEMO, and I teach general practice and family medicine in the Faculty of Medicine here in Coimbra.
Thank you all, and thank you all for joining us all tonight. So we're each going to just take a few minutes to talk about the epidemiology, the impact on our public, the impact in hospitals, and also in general practice or family medicine in each country. So if I just start with the situation in the UK. So as of the 1st of April, we've had 33,718 positive cases, although we feel that there are many more than that because we're not really testing in the community. And sadly, we've had 2,921 deaths according to the figures at the end of the day on the 1st of April. In the UK, the public are significantly affected by this. We've been in effectively lockdown since the 23rd of March, where the people are being asked to stay in their homes other than to carry out one form of exercise per day or to leave the house for essential journeys. Also, if people have symptoms, they're asked to self-isolate for 7 days, and all members of their household asked to self-isolate for 14 days. We're also what we're called shielding our vulnerable population. So people who've had organ transplants, people with cancer undergoing chemotherapy, or patients who are immunosuppressed or have severe long-term conditions are being asked to stay at home for 3 months and not make any ventures outside their home other than for absolutely essential reasons. Our hospitals are under significant pressure, but it's fair to say they're doing an amazing job. We're trying to increase capacity in our intensive care units. We're starting to change the purpose of some of our wards to cope with COVID patients, stopping elective activity in hospitals. And now we're starting to see the creation of what we're calling Nightingale hospitals, large hospitals in event centres in London, Birmingham, Manchester, Glasgow, Cardiff, and more are also planned. In general practice, we seem to be pulling together and coping as well as we can. We're using NHS 111, a healthcare call service, to manage a lot of the activity. And the way we deal with patients in general practice has changed. We're doing most of our consultation now on the telephone or via video, asking patients to use online portals to access practice and to order their medication. We're now starting to build capacity, asking retired GPs to return to work and supporting them to do so. And as I said earlier, we're really focusing on our vulnerable patients. We do have some concerns around the supply of personal protective equipment and the availability of testing, and we're told that this will improve in due course. And we're also trying to focus on the well-being of patients at home, the population at home, and all workers within the National Health Service. So it's a difficult situation. The public and the NHS are responding well, and hopefully they'll continue to do so. So perhaps now I could ask Vesna to give us the experience of Slovenia.
Thank you very much. So it was important for Slovenia that we are very close neighbors with Italy. We're the first with this major outbreak started in Europe. And since actually the last days of February, life completely transformed public life in Slovenia. So we are doing pretty much the same as you're doing, with maybe some exception that we did manage to flatten the curve. So the numbers we are dealing with are not as great as in your country, but we are also a small country. So if you calculate per million, I think we are pretty much the same. We are somehow waiting for many patients to come, and it's really bad feeling. It's like before the rain, you know, you're waiting for the thunder and the rain. But we had quite some problems because of the lack of the protective equipment and also the respirators. Somehow the feeling was that many of the people are going to die and we are not going to be able to help them. That's why we did try to enforce our palliative care. And also we were very afraid because there were some suggestions that women are planning births at home as well. So we had a lot of preparation going on, and we hope on the best.
Thank you, Vesna. Joseph.
Yes, the epidemic started earlier in Spain, and unfortunately the number of cases today was 110,000 cases, and registered deaths today for coronavirus are 10,000 in Spain. The number of cases increases rapidly. Since yesterday, 950 new cases tested are in Spain now, but these figures are only referred to those patients who have been tested. There are probably more cases of untested patients. Patients and deaths concentrates mainly in the two big cities, Madrid and Barcelona, and the surrounding areas. And there are also cases in the Basque Country, Andalusia, and then decreasing depending on the regions. The role of hospitals and primary care is outstanding. In hospital care, all doctors are devoted to see respiratory patients, mainly coronavirus patients. So orthopedic surgeons, dermatologists, psychiatrists, these days are only seeing coronavirus patients. Operations have been delayed as much as possible, and tests also have been delayed as much as possible. In primary healthcare, we see patients, but we also are dealing with patients through the telephone or video calls, and primary care doctors in big practices try not to merge those doctors doing phone calls with those doctors seeing patients directly. It is expected that the curve at some point of time will flatten. We do not know when will it be. This is the third week of isolation to my memory, but we are still fighting every day, working long hours, working on weekends, just to try to cope with the epidemic.
Thank you, Joseph. And now perhaps Katerina.
Hello. Yes, indeed, the situation here in Portugal is also a little bit in crisis. The confirmed cases are 9,034. We have 68 people that already recovered. and 209 people that died. Some of the people are being seen by telephone calls and contacts by their general practitioners. And in vigilance, we have 21,798 cases. The cases are more concentrated in the north and Lisbon regions, but some areas feel that cases are being under-registered, mainly because we feel we have not sufficient tests available. The growth rate decreased from 35% to 20%, but we are not sure about this data just because of the reason I just told you, because of the lack of tests. But we hope that in the next few days, some of the solutions are going to be put it into functioning. We have, this affects very much the public, mainly since the 18th of March, when the alert status was declared. And we think that this alert status is going to be renewed today with measures a little bit more strict. One of those is for example, mandatory confinement is going to be possible in not just in homes and in hospitals, but also in some hotels. Another measure is to release some of the prisoners here in Portugal. Also to limit the lack of job and in private companies, and to not be able to have the right of strike is going to be suspended in Portugal, mainly in essential services. There is going to be also a price control in stores, in supermarkets, and it's going to be an investment in distance learning, and is going to be permitted the definition of a new scholar calendar. The traveling restrictions, mainly because of the current status of the Easter season that's coming, are going to be put together, mainly because we have several immigrants that come back their homes in this time of the year. And these are the main measures and the main epidemiological data that I can give you just right now.
Thank you, Katarina, and thank you to all of you for taking the time out of your really busy days to come and spend time with us tonight and tell us what's going on in your country. It means such a lot for colleagues from Wonka and UEMO to come together at this time, and it's so important that we can show support for one another across the whole of Europe. So thank you again for telling your stories. We wish you the best of luck. Please stay safe, and hopefully we'll see you all very soon.